First, make sure you have everything you need. You'll need a drug vial, an ampule containing the diluent solution, protective sleeve, a syringe, 2 needles, 25 gauge and 27 gauge, and 2 alcohol swabs. Before administering the fertility injection, it is important to take certain steps or precautions. Check the expiry dates on every box. Check that you have the correct drug and strength. Wash your hands with antibacterial soap and warm water and clean the skin around the injection area. Do not touch any uncovered needles. Preparation. Step 1. Attach needle to the syringe for mixing. 25 gauge thickness and 1 1/4 inches length. Twist to tighten and set aside. Step 2. Hold the ampule base upright, tap the ampule gently to ensure all solution is at the base. Looking for the scoring line at the neck of the ampule, hold the top and base firmly. Step 3. Hold protective sleeve from the top of the ampule and snap the top off. The ampule should break at the neck only. Step 4. Insert the needle and draw out all the solution from the ampule. Step 5. Now take the vial, remove its cap and wipe the top with an alcohol swab. Step 6. Insert the needle at an angle through the grey rubber circle. Point the needle tip to the wall of the vial and gently empty the solution into it. Step 7. Remove the needle and rotate the vial by swirling it between your thumb and index finger. Step 8. Swirl until the solution is clear. Step 9. Pull back the plunger to the dosage mark before inserting the needle into the rubber circle. Step 10. Gently inject air into the vial to equalize the pressure so that the withdrawal of the solution is easier. Step 11. Keep the needle in vial and gently invert the vial, upside down. Step 12. Gently pull back the tip of the needle to the same level as the rubber stopper. Step 13. Withdraw the correct dosage by pulling back the plunger or allow the fluid to enter the syringe automatically. Repeat steps 5 to 13 if necessary. Follow the next step when you have reached your prescribed vial dosage. Step 14. With needle in vial, tap the syringe to remove any air bubbles. Depress the plunger to expel air into the vial. Step 15. Turn the vial upright before removing the needle. Step 16. Change the needle, 27 gauge thickness and 1/2 inch length, and the injection is now ready to be injected into the tummy. Tips for less painful injection. Massage the injection site to calm the area of injection. Time is the key. Injecting the drug slowly and continuously helps to reduce pain. Try to relax before the injection. Procedure for subcutaneous injection. Choose the injection site 2 inches from the navel. Ensure that your hands are thoroughly washed before the procedure. Clean the injection site with the alcohol swab. Take the prepared needle and injection. Gently pinch the skin at your chosen injection site using the thumb and index finger of the hand that is not holding the needle. Pinch up the skin. Quickly insert the needle all the way into the pinched area of the skin. If 2 inches of the skin is grasped, the needle should be inserted at a 90-degree angle. If only 1 inch of the skin is grasped, the needle should be inserted at a 45-degree angle. With the needle inserted, release the skin and inject the medication by slowly pushing down the plunger for about 20 seconds. Remove the needle at the same angle that it was inserted and discard it safely. With a gauze swab, apply light pressure on the injection site for around 20 to 30 seconds.